A two-day forum of Nigerian health commissioners has been held in Abuja with discussions centering around adequate funding to strengthen the health system in the country. While declaring the event open, the Secretary to the Government of the Federation, Boss Mustafa, disclosed that the government will make COVID-19 vaccinations compulsory for all federal civil servants. But this mandate will only be imposed after the government makes the vaccines available. Kemi Balogun has more in this report.
Nigeria's healthcare system, like many others, has been plagued with various challenges, and the pandemic showed up to expose the inadequacies and lapses that exist in it. The Nigerian Health Commissioners Forum is mainly concerned about the factors that hamper the effectiveness of the health system, like the lack of adequate funding and private sector partnership. SGF. The Secretary to the Government of the Federation reveals that the federal government will support this move of the health commissioners while appealing to striking doctors to sheath their swords and return to work as the entire world battles to control the pandemic. In the midst of mixed reactions trailing the enforcement of compulsory vaccinations by some sections, the SGF reveals that federal civil servants will also not be left out.
I urge you as commissioners to provide effective leadership at state level. We need to do everything to make sure that even at the state level, as we're preparing for our 2022 budget, that we resource the provision of health infrastructure and do something drastic and dramatic, because this is the best season. Let me state, however, that federal government shall very shortly unveil its decision on mandatory vaccination for every employee in its service. We are working on a protocol.
When we have functional systems at the primary care level, then we will not clog the activities that are ordinarily meant for the secondary level and tertiary level of care.
The Nigerian Health Commissioners Forum wants these issues addressed down from the subnational level for the benefit of all citizens.
Sustainable health financing, the governance structure, infrastructure, and of course, putting all this together, we should be able to achieve universal health coverage at the subnational, which will improve the picture you see at the national. All of this will take care of the diseases, the outbreaks, and their response. It will take care of maternal mortality, on the 5 mortality, name it. Once we can have a functional structure, the health system being resilient and functional, all of this will be taken care of.
The theme for this two-day event is building a strong health sector in Nigeria through collaboration and strategic partnership. And these experts believe that focusing on issues with the effective implementation of health policies is the way to go. Kemi Balogun, TVC News, Abuja.